All right, well, I'm going to get started. This is Danielle Varda. I am the CEO of Visible Network Labs and the co-director of the Center on Network Science. I just want to welcome everyone to our webinar today, Network Leadership Lessons from the Field. It's my pleasure to welcome Dr. Jeff Kuhr to our webinar series today. I think you're going to find that he's really engaging, and this is going to be a really fun webinar. As we always do, we're going to go ahead and get started with doing a little bit of background first on the series and our organization before we get really deep into our discussion with Jeff. Just a little background, our team over here at Visible Network Labs and the Center on Network Science is myself and Dr. Robin Mobbs, who's the co-director of CNS. And you can see our team over to the right. Most of you have probably heard from Melinda Mochizuki, who runs our learning lab and has been the one to support all of this work. So we're super grateful for all of her work and support that she does. We'd like to give you a little bit of background on our organization and what we do and why. We believe that health and well-being is rooted in supportive connections, and so it's really important to us to find ways to support communities and build out capacity for people to do more work around networking and collaboration and connections. We do that at Visible Network Labs in three ways. We do data analysis and visualization through our dashboards and our free mapping tool. We do data collection, and we have ways in which people can create their own surveys and use our mobile apps to collect data. And of course, the thing that matters most is how to make sense of it all. So through our learning lab, we focus on that, and through trainings and webinars and our connected community. And we have a huge announcement that on March 4th, we are launching our whole new platform that's going to open our community forum. So if you're joining today, it's going to be the thing you can do next. Come on and do all of that. We are so pleased that we have this partnership with the Center on Network Science at the University of Colorado, Denver, where we get to do most of our systems evaluation and research work and co-host things through our learning lab. So just a couple of quick ways that we do this work. We love to think about network science. I'm not going to go through these. We make these infographics to help you understand what that is. We provide all kinds of support for ways that you can use these tools, and we thought we'd give you a little look here at some of our dashboards and how you can use them if you're interested in those kinds of things. But almost more importantly right now is to announce is our upcoming Network Leadership Training Academy, April 15th to 17th. That's in Denver. It's going to sell out. It's already, we're pushing already on the enrollments. And it is a place where we gather as network leaders and people in communities doing this work to spend 3 days together supporting and building skills and learning about this. We have a very cool agenda this year, and it's going to be, we can tell, really our best year yet. So we're really excited about that. And, so please check it out if you haven't already and sign up soon. And lastly, an announcement, our webinar next month is with Blythe Butler, who's talking about network governance as an empowerment tool. She's a good friend and has been working with the First 2000 Days Network for ages now, and has really great insight on how we can build networks that are really empowering people and communities, rather than thinking about kind of top-down approaches or real facilitative approaches that give kind of all of the authority to one group. Of course, if you want to stay connected, there's a lot of different ways. We'll send out this slide deck after. And just one last transition here before I introduce Jeff. We do like to just talk for a minute about why we do this work. We know that there's a new norm in the way that people work together called the network way of working. That's what we call it. And it's really an expectation now that people who work in organizations are expected to work across boundaries and connect with one another. It used to be that people joined organizations and were hired because they have their particular skill that they were trained in, but now people are also being asked to work in partnership and in collaboration with the others, and we just acknowledge that there are really very few ways for people to build the skills and learn best practices and how to be effective in that work. So we've developed our network leadership programming, and we base it on 7 core values. The first is that we believe network leadership is inclusive, so it's not just for the person running the network or the organization, but it's really a practice and a skill base that should be shared with all of the members of people involved in networks. So we try to create support for that kind of inclusion of people in network leadership. We also will never tell you these are the 7 best things you should do in your network. We believe that all networks are community and culturally sensitive to their history, the way people talk together, and that really what people need are skills to be adaptive to the ways that their communities are different from each other. Of course, we're relationship focused, skill based. We do believe in data, and we love to bring this core competency to people as a skill, but as a way to be reflective and adaptive. And just finally, our framework is we focus all of our work on ways to build, manage, and evaluate effective networks. So that's been really important to us to be sure to create content that focuses on those core competencies for folks. So that's what we're up to and why we do this work. But now to get to the good stuff, it is my pleasure today to welcome Dr. Jeff Kuhr to the webinar today. He is the Executive Director of Mesa County Public Health. Admittedly, we have changed this title a few times, and you're going to see on Jeff's slide that he probably nailed it finally in the end here. He's going to talk about building networks in Mesa County, Colorado. But his work touches on building social connectedness, social capital, and focused on upstream systems building approaches to address different health demands. And before we get started, we think that it's fun to spend a minute with our presenters to ask a couple of questions. And the reason that we do this is because it's really been our privilege and something really fun for us in our organization to meet a lot of really neat people out in the world who are doing these kinds of things, this kind of work. And it's one thing to learn about their programs, but to understand their motivations and kind of the person behind the slide deck, we just don't want to keep that to ourselves. So, so with that, I want to say hello to Jeff. Welcome today. And, oh, I'm sorry, I've actually muted Jeff. There we go. Sorry, Jeff.
All right. Can you hear me?
Yes. So Jeff, thanks so much for coming on today. I wanted to start by just with a little story about how you and I got connected. In our kind of small but complicated world of public health in Colorado, I've been, talking a lot about social connectedness. I've done a lot of work on social capital, and a number of people kept saying to me, "Do you know this guy in Mesa County? Have you talked to the health director in Mesa County? I think you guys should connect." And we did, and I think we instantly felt there was a lot of synergy. I think I call it we're kindred spirits around the things that we're both interested in and trying to promote. Although Jeff's the real deal, he's doing it in practice out in communities, and we're just over here trying to support that kind of work. So, so Jeff, to get started, I thought it'd be great to be able to ask you 3 questions. So first one for you is, can you tell us what it was about Mesa County that made you say yes to come and lead the health department?
Sure, and let me just start by saying thanks very much for having me on. And I have a lot to learn from you as I go through my processes. You're helping me put definition to what we're doing, so I have a lot to learn from you. So
Awesome.
More to come, right?
Right.
So why did I come to Mesa County? I came here because, well, I came from Eastern Nebraska. I was a director of a health department for 3 counties that surrounded Omaha. And so I wanted to be in Colorado and came out to Mesa County. It was appealing to me because it's a large, we're a large community. Our county is about 150,000. And had turned down the same health director position in Durango about a year before, just because it wasn't the right fit as far as size goes. And as we progress, what we've learned here is that we're a perfect kind of a pilot ground for everything that we do. All of our health leadership things, because Mesa County is small enough that we work as one unit, and we're large enough that we're full service. And so it's a great place. In fact, Kim Bimstuffer was here day before yesterday. She's the Director of Healthcare Policy and Finance. doing a pilot project with hospital transformation. So it's a great place to be as far as that goes, because we can see a true effect from the work that we do. So
awesome. Well, what is it about Grand Junction that makes Grand Junction a great place?
It's a location-wise. Well, I'll tell you a story. I went to a concert, Fleetwood Mac, a few weeks ago in Denver.
Yeah.
I drove home on Saturday morning and thought, holy cow, I could get to any of the ski resorts faster from Grand Junction than people can from Denver. So
Nice.
it made me appreciate where I live.
Awesome. Oh, good. Okay, so to work focus, what motivated you to get started on thinking about upstream factors that impact the public's health?
So as you'll see in my slides, our socioeconomic issues are, we differ quite a bit from the state. And so, we're co-located with the Department of Human Services, and a couple things have happened with that. One day, the Director of Human Services came over to me and he said, Jeff, your folks, they want to come over and they want to hang posters in our counseling rooms about eating healthy. And he said, we're sitting here pulling kids out of families or dealing with child welfare cases, and you want to just come over and talk about nutrition. And I was like, man, that is really a really good point. And then one day he and I were sitting down and he said, everything you do, it takes such a long time to see an effect from. Thinking about, in public health, if we deal with cancer or heart disease, it takes years and years of effort to try to reduce those things. And I said, Tracy, what if we measured what I do based on the outcomes related to human services? And so ever since then, we started thinking about that. And so it's led us to go beyond simply talking about programs all the time and talking more about let's try to change the culture in our community, because really, for me to go out, or my staff to go out and do smoking cessation programs or talk about obesity, Mesa County is not in any state to absorb that message. And so so we've decided that let's have an impact on the more upstream issues and put people into the better state that we can start to talk about health down the road.
Wow. Well, that is very inspiring, actually. I think you're a leader in that space of thinking, and especially leading a health department, asking human services to measure you that way. That's amazing. Okay, so I have my last question, my question 3. I always do 3 questions. Is a little more about you. So in a year from now, what do you hope will be your greatest professional accomplishment, and what's going to be your greatest challenge to achieve it?
Retirement, no. What kind of sucks about these webinar things is I do joke around and I can't hear anybody laugh. So it's going to be very hard for me.
Nothing over here.
In a year from now, so we have, with these upstream approaches, it's always difficult. So let's take the example of sitting in a meeting with county commissioners and all the directors of the county departments. Public health is never on the list of what are our objectives for the county or anything like that. We're sort of a necessary service in the county. So I've learned to start talking more about economic development and things like that, and try to speak the language of the commissioners and the rest of the county. And so our projects have started to take hold in relation to economic development. And so what I hope in a year from now is that we're seen as a main source of the solution to the overall health and well-being of the county, but with things that are important to county commissioners and city officials and things like that. So,
awesome. Well, I think you just taught us all already our first network leadership lesson. You said speak the language of the rest of the community, and I think that's a huge lesson that a lot of us forget to do. We stick in our silos. So, thanks for bringing that forward already. All right, so without any more hesitation, let's go ahead and switch screens and let you go ahead and get started on this. I think everyone will find you can tell just by these conversations with Jeff, the early conversation here, that he has quite an interesting and innovative way of thinking about public health and our health today. So really excited about hearing more from you, Jeff.
Okay, and can you see my slides?
Bet.
All right. So is this the slide that we changed the title?
Here it is. Yeah, this is the actual title of this webinar, folks.
I wasn't even thinking about that when I did this.
It's the perfect one.
Well, and Danielle, that's where you've got me thinking about this stuff. And as a matter of fact, the preface to what I'm about to talk about is networks in the community and networks as a system trying to work with the community. So there's two networks that we're going to be talking about here. So let's talk as I mentioned, let's talk about what Mesa County looks like. So our median household income is $14,000 below the state. 56% of our jobs pay less than $17.50 an hour. 22% of our kids live in poverty compared to 15% for the state. And among those kids, 69% are in a single female household compared to 51%. In fact, in our needs assessment, single moms just came up as a group that is just in great need for things that we need to do to help those folks. Our child abuse and neglect rate is twice the state's rate, and our fourth grade reading and math scores are 25% lower than state averages. So, we're considering lots of different things here, but these are things that I can use to make my point with my programs. So I'll get into that more here in just a second. So 2 years ago, we're still multiple agencies working independently to address each issue. In fact, I was at a city planning meeting yesterday, a focus group, and it's so apparent that everybody's got their interests, that we keep competing to get on top, and I think it hurts us overall when we're not working together. But 2 years ago, we recognized this, and we took the first steps to try to address it. We were in a meeting with the superintendent, director of human services, director of a couple of big human service agencies here in Mesa County, and myself. And so we just had a teen suicide. Our suicide rate is very high here in Mesa County, and we just had a teen suicide. So the superintendent brought us all in. He said, we have got to do something about this. We've got to work together. And I said, Steve, I've been asking you to work together for 3 years. But see, that's the call to action. If you all know the health belief model, the call to action was that suicide. But even within that group, we couldn't agree on the approach because we all wanted to be in charge. And so I said, I will pay for a consultant if you will all agree. And they did. And it was great. So we brought in the Civic Canopy and to facilitate a year-long planning process. And it was quarterly meetings. And over those meetings, we had about 75 or so stakeholders. And the first meeting was in January of 2017. So this is off of Civic Canopy's website. And I always use it because I think it fits so well. There's broad agreement that the problems we face are so complex that no person, nonprofit, corporation, or government agency has the power to solve them alone. And, I wish everyone could just take this to heart because it's the struggle that we have every day. It's not that our programs aren't good. It's that we aren't working to complement each other and work along a continuum. So let's talk about the Community Transformation Group, creating networks by building social capital. So this was the project that came out of that year-long process with Bill Fulton and the Civic Canopy. So why social capital? And here, these are a couple things that we've used, and these really are impactful to me, and I'll explain more after I just read through these. So solid community ties, including trust in institutions and within neighborhoods, are associated with economic growth, higher academic achievement, and lower crime rates. And then strong connections have a greater effect on health than quitting smoking, losing weight, or exercising regularly. So going back to the original conversation prior to me doing this presentation, Danielle, is social connections are greater than me going out and doing programs in the community. So this kind of makes my point. It was interesting when we convened as our large group because we decided to bring all of the social determinants of health and ask Bill to give those to the large group, the 75 member group, and ask them to prioritize them. And so what happened was, so we broke into small groups and we did our rounds, and what we came up with, what was hard for this to happen because all those social determinants got clustered. So what we came up with as our priority areas were health, economic development, and education. But one social determinant made it without being clustered with the rest of them, and it was social and family connectedness. So we thought, okay, that maybe we're onto something here. And so that was the thing that we thought, all right, if we could really take social and family connectedness seriously, it would lead to better health, better economic development, and better education. So that was the start of this whole process. So we define social capital as personal relationships, social network support, civic engagement, and trust and community norms. And really, that's a hierarchy in order with what you see right there. And so we administered a survey. It was important for us to be able to define social connectedness or social capital for that large group. So my staff went out, we put together a survey, and the survey is around these 4 areas. And so we designed the survey, but we found a question bank that was from Great Britain or somewhere like that. And so we put the questions together, and then I put my staff out into the street because we needed this soon for our next meeting. So we did collect 1,500 responses, and so we got some great survey results around social capital, and that once again was great for us to get started.
Yeah.
So a friend of mine, Jerry Evans, came up with this. I believe he came up with it, or if it came from somewhere else, please somebody let me know. But I think this defines this really well. So if you look at box number 1 at the top, low social capital. So it has to do with your connectedness with family, friends, and neighbors. Leads to low community trust, which leads to low access to needed resources and programs and low self-efficacy, which leads to low community participation, and finally, quality of life disparities. So this really defines this well because we look at things like eligible but not enrolled for WIC, for child care assistance, for SNAP, and we say, why do we have such low or high eligible but not enrolled rates? Well, a lot of the answer is in this, is that we need to start to address social capital. So the community transformation group is what formed out of, it's a subgroup out of that larger group. It's a network of businesses, community organizations, and individuals working to improve the social capital of our residents in Mesa County, and we're doing it one neighborhood at a time. So we started to meet, we started to say, all right, if we're going to do social capital in Grand Junction, what does it really mean? What are we going to do? Let's get neighbors to be more engaged with each other. Let's get parents more engaged with their schools. Let's get law enforcement more engaged. And what we decided was to ask that question for Grand Junction, to even take it back to the larger group. People were looking at us like, you're never going to do this. I mean, Grand Junction itself is 50,000. And so we came back to the table and we said, we've got to do this smaller scale. And so we decided to focus first on Clifton, which is an unincorporated area of Grand Junction. It's about a 10,000 population. And someone at the table said, it's still too big. So we came up with one elementary school and its primary service area, a square mile. And And it just so happened it's our highest crime area, and so it was a really good fit. So everybody was in full agreement, and even the school district who was at the table said, yeah, we could commit to one school. We could do whatever you guys need us to do. So we focused our efforts around Rocky Mountain Elementary School in Clifton. So from this process, focusing on Rocky Mountain Elementary, we came up with our action map. So the priorities were build a sense of community in the neighborhood. We want neighbors to partner with local organizations towards solutions. So when we did our focus groups, we just found that, let's get back to even the definition that we're using for social capital. The trust was very low. Trust in law enforcement, trust that there would be any response with code enforcement. So the trust wasn't there. So we knew that we needed to build trust between our organizations and the neighbors themselves. And then finally, increase participation in neighborhood activities. So those were the three areas that we came up with after talking to the residents in this neighborhood. And so those are the things we've been working on. So let's look at these individually. Build a sense of community in the neighborhood. Social cohesion is impacted by the way people think and feel about their neighborhood. And individuals who believe they can empower themselves and each other create a lasting, positive change in the neighborhood. So these are our driving principles for that one. Under neighbors partnering with local organizations, community organizations work collectively to invest their time and resources to help a neighborhood reach its highest potential. So what we basically say all the time in relation to this is that in this one neighborhood, we are all doing our jobs better than we do it in the community as a whole. And so it's been impactful, and it's good. That's a good principle to rely on. And then second here is commitment from an organizational level can result in increased neighborhood involvement, trust, and sense of pride. And then finally, the third area, increased participation in neighborhood activities. The conditions or attributes that go beyond what is typically available, but which can enhance lives. And then positive engagement can reduce the negative impact of a problem. So those are all of our principles within our action map. And we're also considering the 2-gen approach. So if you take a look at this map and the various components, you see social capital as part of the 2-gen model. Early childhood education, post-secondary and employment pathways, economic assets, and health and well-being. So, well, actually, let me just jump to the next slide because it kind of shows our approach. So within 2-gen and social capital, education, economic assets, and health and well-being, so the three other components are all critical elements of the 2-gen model, but social capital can be a catalytic force in driving change for low-income families. Social capital is a network of people and institutions upon which a family relies. So going back to the model, and I've talked to the folks at Ascend at the Aspen Institute about this. If we first concentrate on social capital, we will have more success in these other areas. Not dissimilar to what we thought when we clustered these originally around education, economic development, and health. So, so very similar. I think it's hard to approach these without consideration of social capital. I just don't think you're going to see the outcomes. Oh, I'm going to go back because this is my next initiative. So let me talk about a few things that we're doing as a result of this. So the sheriff's office has implemented this community policing strategy, and they're doing it in all areas of Mesa County, but we're particularly watching our neighborhood. And crime has reduced significantly since they've started that approach. And community policing for them is going out and being more proactive, building relationships in the neighborhood. And it's been tremendous to see those crime numbers drop. We've implemented an after-school program. It's called Riverside Education Center. It's been very successful in one neighborhood in Mesa County and highly supported by the community. So we helped them write a grant. They are now located in our school. And in fact, we also, the health department purchased 2 buses for them to participate. We've hired a promotora to work because there's a significant Hispanic population as part of this neighborhood. And then we also, as the public health agency, hired a code enforcement person to work with the county, but to respond first and foremost to the neighbors in this area. So we're just showing these folks that we're with you, we're going to respond to you, and I have a full-time staff person. Her job is to do nothing but work in this area. And let me go back to originally when we talked about the health department going upstream. I don't really have health educators anymore. All my health educators have been repurposed and have been expanded in their roles. And so they're all community organizers. And I've got about 5 of them now. And so not just with this project, but with others. Most recently, in fact, we're about to hire community organizers to work with our outdoor recreation folks. So so that's kind of been the restructuring of the health department to not really serve or deliver programs that may compete with others, but to actually empower all of our partners and to serve as that core manager for the public health system. So I don't know, do we want to stop for any questions so far, Danielle? I can't see that screen, so.
Yeah, not yet, but thanks for actually asking that. So anyone who's on the webinar, if you go to your little Q&A button at the bottom, you can load in questions there. I forgot to say that when we started. And Jeff, since you just took a moment, I want you to keep going. I'm just going to say what you just went through, you go through so casually, and it's so innovative. It's so amazing to hear you talk about these things as though they just happened and they just did them. So I've got lots of questions for you at the end. So please keep going, and we'll keep doing getting questions in the question bank ready.
Okay, it's funny. Somebody just sent me a note actually yesterday. From Colorado Department of Public Health and Environment, and they said, we want to bring Jill, our new director, out to Mesa County. When works for you? And I said, well, let's wait a really long time until she completely understands this approach that we're on, because I think it's very important for her to learn about it first and then come talk to us about what we're doing, because this is pretty foreign in public health. And so but she said, no, I want her to come right away because I want her to see what you're doing to maybe change her thought on approach. So I thought that was interesting.
Well, one thing I will say, and there was just one quick comment from someone who said, can we get a copy of the slides? And that's, as long as we have Jeff's permission, yes, we always plan to send out the recording and the slides. But you know, Jeff, we've talked about this before. When you said that, you know, you all narrowed in on, you know, the social determinants that were most important, but then you kind of backtracked and said, you know, really social and family connectedness is the driver of whether those social determinants are affected by interventions. And you said when you tell people that, you know, I asked you one time, how do they react when you say that to people? And I think we both talked about how people always say it's too big. That's too much. You're never going to be able to go, you know, down that track. We've got to address these other things first. And I wonder if you still get that reaction.
We do. And maybe go back to the question of what do I see a year from now? It is for people to understand the importance of this, because it all sounds very conceptual, you know, to say social capital. You know, when I even use that term with people, actually the term I always use is community connectedness, because or building a sense of community is what I say. And because yeah, it's hard to convey that. People certainly don't put anything tangible with that. So I think the burden is on us to prove it. I'm not going to sit and try to explain it away. I just think in a year from now, there will be some tangible results that people can say, oh, now I get what you're talking about. So
yeah, excellent. Okay, so yeah, please keep going.
Okay, this next one will be quite a bit shorter. The second project that we're working on in Mesa County is is childcare. So the project's called Childcare 8000. And so I was fortunate enough to be part of the first class of Ascend Aspen Institute fellows. We had a cohort that was Colorado only. And so 20 of us went through that program last year for a year. And our North Star was early childhood education. And so this was my project for that. And it fits very well with what we're doing, that has to do more with the upstream, building a base for the community. So, so this is it. And let me just kind of show you what we've got. So here's what we look like in Mesa County. The number of licensed slots that we currently have can serve less than 25% of the kids 0 to 5 years of age. And the number of kids based on the census that need childcare in this age group is 61% in any given population. So that's the estimate of families with working parents that need childcare. So of the 61% of our kids that need childcare, 25% of all the kids 0 to 5 are, we only have enough licensed slots. And licensed is important to us because it's definable and there's a quality component. And with that quality component comes a curriculum component. And if we go back to my first slide outlining Mesa County and talking about our school readiness, our reading and math scores are 25% lower than the state. And then let's take this over to other sectors, and I'm all about multiple sectors. From an economic development component, we know, or perspective, we know that we try to recruit a lot of industry into Mesa County, and a lot of people don't come here because of our education system. So this is a big deal. I think if we can prepare our schools or our kids to go to school and be better performers in school, it's going to improve the overall education system. So how's that for a public health role in impacting the overall outcomes of the community? That's something. So we have high needs areas in Mesa County. So considered childcare deserts. Clifton is one of those areas, which happens to be the area that we're working on that social capital project. Our current facilities are operating at about 70% of capacity because we don't have qualified staff. And here's why. The average hourly wage for childcare lead teachers is $11.50 an hour. And to become a lead teacher, you have to go through a credentialing process that is the equivalent. The process that we use in Mesa County is called the CDA. And going through that is the equivalent of 9 college credit hours. And so that's a lot of training to earn $11.50 or $11.50 an hour. And obviously that'll go up to 12 as soon as minimum wage goes up, but the agencies can't afford to pay them. So because of our limited options, we have the highest number of exempt CCAP, so Colorado Child Care Assistance Program providers in the state. Sometimes I hear our folks in meetings bragging about that, but actually that's a bad thing because we don't have enough licensed facilities. We're exempting providers, so all they have to do is go through a background check. So they're unlicensed and they become CCAP providers. And then also our child care tuition rate, we are the lowest in the state. We're 30% lower than the state average. Our tuition rate is the lowest in the state. However, we're not trying to address this issue by raising the tuition because as you can see with our economic variables, we're not in any place that we can start to charge more for childcare. So the goal of our program is to increase the number of quality licensed slots to 8,000. So just about double by the year 2022. And as I was kind of explaining, the outcomes will be improved school readiness, increased resources for employed parents. Let's talk about economy again. We're out searching for industry to come in here, and if we could find an industry that brought in 300 jobs, that would be huge for us. If we got to 8,000 slots, we could employ an additional 300 people in this industry, and at $13 an hour, that would be worth about $8 million a year to the economy. And then ample childcare resources would be a positive selling point for bringing in new business, as I've mentioned previously. So the plan, 3 things. And when we first started, we thought, yeah, we'll just start more child cares and get more slots. And I even called an agency on the East Coast to ask about even bringing franchises into Mesa County. Nobody will come here because our employment, we don't have enough people to fill positions as they would come about. So it is truly a grassroots opportunity for us, and we've got to do it ourselves. But so this is what we found as we've dissected this whole thing. It's really about this, the business cooperative. So what we know in relation to child care pay is that child care providers, the back office component is the place where they vary the most. And I was part of a panel for Department of Labor and Employment. Actually, it was a national thing not long ago in Denver. And the woman that was convening us made this statement of we've got to promote child care as an entrepreneurial opportunity. And I said, nobody goes into this to be a business owner. They've either gone into it because they've got kids that they need to watch on their own, and so they're going to make more money and pull in more kids, or they really love kids. And so they're not business operators. So what can we do for them? We need to centralize our resources in relation to purchasing, payroll, food preparation and delivery, nurse consultant. So that's something that we're trying to put together right now is what can we centralize to decrease their costs? An example of where this hasn't worked is in our focus groups, we asked the child care providers, where do you buy your gloves? Most of them said Sam's Club. It's $6.50 or $7 a box for rubber gloves. There's a resource through this agency in Denver called Early Learning Ventures, where it's a kind of a centralized purchasing portal, and we can buy gloves through Staples for $2.50 a box. I mean, that's one example of what we can do, and that's something that is not being taken advantage of. So we can do that on their behalf, because the other thing with this is I don't want to go train a bunch of providers to use a computer portal or a web-based portal, because we can't depend on that they're going to do it. I think it's better if we just do it on their behalf. So that's we've got 3 pilots that we're working with right now to kind of get this all figured out. The second area is career pipeline. So we partner with our workforce center, Western Colorado Community College, and then an agency called Climb Wyoming out of Laramie to train new people to come into the workforce. We can use WIOA dollars, other workforce dollars. We can use community services block grant dollars. And in fact, we have a group of 20 that are going through the credentialing process right now. We're paying for that with community services block grant dollars, and then workforce dollars are paying their college credit. So they're going through the credentialing. It's a 20-week process, and we're also getting them college credit. And that's significant because every 3 years they have to renew, but if they have college credit, they don't have to renew. So that's the reason we're doing that. And then finally, business partnerships. This impacts businesses. Lack of childcare impacts businesses or lack of choices in childcare. And so we're pulling our local businesses together to get them to invest in the system. So not through scholarships, not through anything, but through childcare system development. And had our first meeting with a small group that will be our guiding committee for this, and people are excited. And there's an opportunity in Colorado called the Child Care Tax Credit. It's called something slightly different than that. But what it is that it's a 50% tax credit. Actually, it's a dollar for dollar, 50% back for every dollar invested. And on the Front Range of Colorado, it's worth, they have so much participation in this, it's worth about $50 million a year. But we have nothing going on the western slope. So if we can just engage businesses to do that, that would be huge. Our goal is to get the lead teacher hourly wage, the starting wage, to $13 an hour. And then we think that we'll start to drive a whole industry. I know that seniors in high school that can earn college credit could get that credit while also doing the certification or the credentialing. We could start to bring those folks into the childcare industry. And there's certainly a career pathway through this as well, because you could go into Head Start programs, pay a lot more, preschool programs through the schools pay a lot more, or you could continue on, get a bachelor's degree in education and become a school teacher. So just identifying all of these pieces. And the $13 an hour thing is important because what we want to do through the co-op, if a child care agency will participate in the co-op and do everything they can to become more efficient, what we're proposing is that if they can increase the hourly wage by 50 cents with their employees, we would match that 50 cents with our business partnership pool that we're going to build. So try to get an extra at least $1 an hour to help these childcare folks off. And I know what you're saying, that's only $12.50, but that's kind of the most tangible way we can propose this, but try to bring that up to $13 an hour. And I think, momentum. So this might be the last slide. I know I'm rambling. So it's been important for us to get funding for this, not from the perspective of we really needed it, but from the perspective that this idea is catching on and people value it. So we have gotten these grants in the past year, which is great. The food program, expanding the food program through a grant from the Colorado Health Foundation. We got a 2-gen grant from State Department of Human Services. We were one of 6 agencies awarded statewide awarded the Workforce Innovation Grant. And then Colorado Department of Human Services just gave us $60,000 for additional teachers for the credentialing process. So good momentum going. We're continuing on. Once again, I have a full-time person that does nothing but this, that works for the health department. And then we also do the licensing and all that. So we've got about 7 employees dedicated to early childhood education at the Mesa County Health Department. So, wow. So that's it.
Yeah, that was awesome. It's funny when you said you feel like you're rambling. I don't think it seemed like you're rambling at all. I think everyone is absorbing an enormous amount of information that it's clear you have. So Jeff, we have some questions, and I'm going to start with this one. Okay, so this one has a kind of a couple from Elizabeth. Thanks, Elizabeth. Okay, so what was the feeling among health department staff with this kind of restructuring? The comment here is, I love the ideas, but would have a riot on my hands.
That's a great question, because we're still working with our staff. Our new strategic plan is all around, there's a national model for local public health called the Public Health 3.0, or the Chief Health Strategist. And so we've incorporated that into our new agency strategic plan. But it is hard getting folks to not think about just their programs. And so even as I'm out in the community trying to preach about working together, working collaboratively will benefit you more financially than just chasing after grants all the time. I think we're making a good pitch. But we're doing that in-house as well. And a good example of that is that if you've got somebody that comes into WIC, we've got that staff working to say, all right, how do we complete this person? We're working from the complete person concept. If somebody is eligible for WIC, SNAP, child care assistance, free and reduced lunch, we've calculated that could be worth an additional $3 an hour to a $12 an hour wage earner. And so my staff is starting to get that, and we're starting to function that way as an agency. But I did get pushback at first. WIC staff or healthy communities, they would say things like, well, why is our goal, to address eligible but not enrolled? All we're doing is addressing the goal that the state's given us. And my mantra is always, never stop at what the state says you should stop at. Let's go over and above. So work in progress. The agency's coming along very well with this.
Nice.
I don't even know if that answered Elizabeth's question. I don't know.
Well, and I'm guessing that, there can be some connections we can make after for you busy people. I can, to connect with each other. So we have 3 questions about almost the same topic. And so I'll kind of answer all of them, ask all of them together. So one is, you seem to have a lot of leeway in your budget. How did you get there? But also asked this way, you indicate that you've received these grants and have built staffing. This is terrific. How have other partners like Human Services been contributing to or receiving the staffing funding? So in general, how are you resourcing this work and making this all happen?
So Human Services, so at the beginning of the presentation, when we talked about making Human Services part of what we're trying to be our outcomes, we have an awesome partnership with Department of Human Services. And our Workforce Center is under the Department of Human Services as well. So they have rethought what they do with TANF dollars and workforce dollars. So they are full on board with this project. We work with them, like with the Climb Wyoming thing and workforce development. We are going to hire kind of a sort of a child care workforce trainer person that will reside with the Department of, or with the Workforce Center. So, those sorts of efforts are these money coming to the health department, but positions being placed in the Department of Human Services. But what was the first part of that question? Oh, where do we get the leeway in our budget? That's a great question. So when I came here 8 years ago, I took every one of my programs. I had my CFO. So just so you know, I have an $8 million budget and 80 employees. And so I had my CFO take every one of our programs and put them on their own separate sheet of paper with their revenue and expenses. And so we started looking at all of them. And at that point in time, a county commissioner said to me, "Man, you guys spend a lot of money on admin." And I was like, "God, we do." So we had 5 division directors at that time, and through attrition, and it didn't take long, because if you set the vision, people are either on board or they're not. And so we scaled down. So now I only have 2 division directors. So with the money savings from those, $110,000 budget items, I started to invest those into positions that are more boots on the ground. We also don't do programs that don't really have any link to us. So we liquidate programs. We find partners in the community that would better serve for these programs. And so we put them out there. And finally, every grant that we write anymore has nothing to do with administering a program. I tell people this all the time. We don't need new programs. We need to do what we do better. And so all of our grants are like systems grants. And what that allows us to do is have flexibility to build. And it doesn't result in a whole bunch of deliverables for something that we're out there counting widgets for. So, so to be honest with you, my budget of $8 million, the county only gives me about, for the past 2 or 3 years, they only give me about $250,000, because we build such a fund balance with indirects that the county is trying to draw down that fund balance, so they only give me the minimum required. And so it's not a huge problem for us. I just think we manage our finances and the agency so well that we're able to use that money to invest in the community.
I feel like that could be a whole webinar on finding that in even more detail. I think one of the things most of us struggle with is how to finance this kind of work. And yeah, it sounds like you're doing a lot of innovative stuff. Okay, so we have just a couple more minutes and a couple more questions. So with all the initiatives going on in healthcare and health systems to do this kind of work, how are you thinking about coordinating into those sectors?
Okay, that's an excellent question. And as I told you, the Director of Healthcare Policy and Finance here was in my office 2 days ago. So she's doing hospital transformation, which is, we've noticed in the state of Colorado, in fact, in the Denver Post, it was a headline maybe yesterday. It was that the profit margins for hospitals are ridiculous. And so she's trying to control that. Thankfully, she's saying, all right, public health, there's a role for you. What is the opportunity with that is she lists our role as vaping and, you know, it's all kind of chronic disease sorts of things, behavior related things. And I said to her, I can give you all this data and I'm all for it. We'll focus on these. However, where we're losing out is our ability to organize the community. So my community health needs assessment that I have to do every 5 years, we do it every 3 years, and it actually serves as the community health needs assessment for our 4 nonprofit hospitals. And I told her we need to get there as a state. And the first step in that is to standardize the community health needs assessments, because right now, if you've got Centura Health that's in 4 counties, 4 county health departments have a different needs assessment. So if public health wants to play a role in healthcare, we've got to see what our opportunity is with, first off, the community health needs assessment, and secondly, these upstream approaches, because everybody in healthcare is talking about social determinants, but nobody has the answer. Here's where it goes wrong. You go to seminars, everybody sits down and says, if I had a care coordinator in my healthcare agency, they could connect people with housing. And I was a panelist once, and I said, let me tell you about housing. There are 2,000 people on the waiting list for housing in Mesa County. So don't just think that hiring a care coordinator is going to solve that person's problem. You need to be more connected with what we have to do as a community. So I truly believe we're building complete integration with this. I happen to be the facilitator of the Mesa County Health Leadership Consortium because I'm in a non-biased role, but that is a great thing for us, and just fact that public health is recognized as playing a role in healthcare in Mesa County. Hopefully I answered that.
Yeah. Jeff, what strikes me the most is with the casualness with which you answer these questions that are huge questions, big systems questions. And I think that's why I personally am so taken with the work that you're doing, because it sounds like, you know, these are the mountains that communities are trying to climb. And there you are. Okay, I just have one last question myself. As a person who loves networks, and I almost, while you speak, my mind's trying to like map out all these connections that you're making to people and places and things. I'm just curious, as like just a person who has a lot in your head there, how do you keep track of all of this stuff? What's your tip for people who just are overwhelmed with all the systems information and people that they run into every day?
Yeah, that's a good one. Well, I'm obviously passionate about it, and there are lots and lots of components. So you know, this all grew out of something small, but it was the desire for public health to play roles in all of the other sectors. And so just from that, each piece comes along, and it's part of the puzzle, and you're just able to convey that all of this connects. It's crazy. When we put this stuff on a board, I have to explain to somebody, this all connects. And as time goes by, it's clearer and clearer to people how everything we're doing, it connects, because these all started out as separate projects when we got going. So I just think the interconnectedness, you almost have the same principles in each one of these projects that we're working on. And so you can roll it all up and explain it in a grand fashion. So. Yeah.
Well, if anyone who knows me or my team, they will know why I say there is a kindred spirit here, because you speak our language. It makes me really excited to every time we have a conversation together. And I'm really grateful that you agreed to share that conversation with a whole bunch of people in a webinar around the country. So we have a big endorsement from Elizabeth here for the webinar on financing examples and management on this. So maybe that'll come one day in the future. So we're just at the top of the hour, and I think I'm just gonna say this. One participant said she kind of wants to hug you right now.
Well, you know, Danielle, and I should have put my email address on here, but I'm just gonna read it, and I don't know if it's anywhere. But if anybody wants to contact me, my email address is jeff.kuhr@mesacounty.us.
Oh, thank you. That's awesome. And what we'll do is we always check in with our presenters after to see if there's any handouts or anything that popped up or they thought of that we can include. And then we'll post this online, the recording and the slide deck. And we'll be sure to, we do a follow-up email. We'll be sure to include your email in there. That's very generous of you, because you're definitely a busy person. But yeah, I think there's lots more that we'd love to learn from you. And your time is so precious. So thank you, Jeff, very much. We appreciate it.
Well, it's been fun, and I so appreciate the invitation. Thank you all for letting me take up your morning.
Awesome. Thanks to everyone who attended today, and be sure to stay connected to us. We'll be doing more of these in the future. So have a great rest of the week, everyone, and I will go ahead and sign off now. Thanks again.